called the spirometry case study. Page 9. All right, so this, you're going to do spirometry 2 weeks, not tomorrow, but next week in lab, you're going to be blowing into tubes and measuring your lungs so we can see how badly your habits have hurt you. So part of this activity is to get you ready for that lab so you understand what you're going to do next week. Part of it is to review what we've done. So here we have Steve. Hey, 2 packs a day. He's going to die. They do all this work. And here we go. So Steve, Mr. Smoker, has respiratory tract infections. Can anyone figure out why smokers would have more infections than non-smokers?
Kills the macrophage.
Remember those 3 things I listed, right? They kill off their macrophages. They kill off their surfactant. So if you smoke, you're more likely to get infections because you're destroying the air sacs. You're destroying that ability. That make sense? That should be review. Here's the part now. He's breathing by his accessory muscle. So for question 2, what the heck is an accessory muscle?
Any other muscle?
Not the diaphragm. Very good. So let's write that down. An accessory muscle is not the diaphragm. Diaphragm is the main muscle. So not the diaphragm. All right. So from first term, that long ago land, name some muscles for breathing that are not a diaphragm. The intercostals, like the external intercostals for inspiration, the serratus anterior, right? All those ones you forgot about. So those are helper muscles, not the main ones. So they're helping me out. So tell me why Mr. Smoker has to use his chest muscles to breathe. To pull more. Why would he need to pull more?
Not flexible.
Not flexible. Yay! The lungs are not flexible. His lungs are scarring, so it's harder to pull. So you need more force to do that. Okay. Need more force. So your brain orders the lungs to inflate, and the chest has to help out. So any of you have patients that have this? What do you know about their chest size? It gets larger, right? Barrel-chested, because you have to work these muscles more. Muscles get bigger when they work. So your chest muscles get bigger, right? Not for a good reason, for a bad reason. You're working harder to get air in and out. That make sense? Okay, so let's do Steve's lung tissue. Tell me what would be missing from his lungs. Because of Mr. Smoker, he's going to be missing some things. So there's no white blood cells. There's going to be no what? Surfactant? Right, so it'll be dry. How about his respiratory membrane? What size do you think it is?
Thick.
It's going to be a thick respiratory membrane. If you go back to 231, there's going to be no cilia. What are the cilia for in your airway?
Getting the nasties out.
Getting the nasties out. That's why you hack every morning, right? You can't get the nasties out. I like that, nasties. That's cool, right? Okay, so now we're going to answer question 5 to go back to question 4. 5 asks his blood gas data. All right. Let's look at his blood gas data. Based on what I taught you, you should be able to figure this out. Blood gases, arterial PO2, arterial PCO2. So again, you don't have to memorize the number, but do you remember what the oxygen normally was?
104.
About 104. His is 73, which is
Very low.
way low. Tell me why it's low in Mr. Steve Smoker Man.
You can't breathe it, get as much oxygen in.
Because of diffusion, right? The oxygen can't get from the air sacs into his blood because he's scarred his air sacs, right? It's harder to get it to diffuse. So his oxygen's going to stay low in his blood. Look at the CO2 number. What's normal CO2?
40.
About 40. His is high. Why is it high?
Can't get it out.
Because he can't do equation 3. So for the first one, he can't do this equation. Therefore, oxygen stays low in his blood because it can't get into his blood. The second one stays high because he can't do this equation 3. He can't get the CO2 out of his body into the air sacs. Make sense? So oxygen goes down, CO2 goes up because you can't exchange. Make sense? So a blood gas test can tell someone how good your alveoli are functioning. Right? So he's bad. Right? If you think about it, that's 73%. Right? That wouldn't pass most things. So that gives us number 4. His hematocrit value. Review from last term. What's normal male hematocrit from lab? Ow, that felt great. 47 plus or minus 7. So his is 59, which is high. Why does he have a high hematocrit?
Trying to carry more oxygen.
Let's review from last term. If you have low oxygen, which he does, you make more EPO to make more RBCs. His body thinks he's in Denver. Because your body never evolved to smoke, it evolved to live at high altitude. So it assumes you're in Denver, that's why you're going to make more blood to compensate. It doesn't realize you're foolish and smoke. Right? So his body thinks he just needs more blood.
Which also means high blood pressure.
More blood pressure, peripheral resistance goes up. You have more blood, but it's carrying less gas. Right? Make sense? So now, here's the question I really want you to understand. This last one. His pH. His pH is 7.32. Normal blood is 7.4. So his pH is lower than normal. Low pH means it is more acidic. Tell me why he's more acidic, and look at this equation right here. Right. He can't get the CO2 out, so he has more acid in his blood. Therefore, his pH goes down. He's acidotic. That make sense? If I can't breathe the acid out, it stays in me. Right? Make sense? So he's becoming more acidic because he can't blow it off. Make sense? Okay. So that ends kind of the lecture component for tonight. I'm going to show you the graph you're going to use 2 weeks in lab. It's not on your quiz next week. It's not going to be something I'm going to quiz you on. This is a lab thing. But to help Greg out, I'm going to kind of walk you through what this graph is getting at. So just ignore in your mind everything from this point on, right? It's not in your quiz.